Well, the doctor is in as a mysterious brain injury now affects two California high school football players who played in the very same game, both running backs. They apparently started acting strangely when the game ended before collapsing just a short time later. One has been released from the hospital, but the other remains in critical condition. And investigators are now looking into whether a popular drug used to treat attention deficit disorder may have played a role in the injuries. Joining us now is Dr. Daria Long-Gillespie. She's ER doctor at Emory University Hospital and Executive Vice President of Clinical Strategy at ShareCare. Thank you for joining us.
Of course. Thank you, Heather.
Well, as parents hear this story today, especially if they have students who play football or any sport in high school, they're definitely troubled because about 47% of high school football players suffer from some sort of concussion every year. How do parents know, how do doctors know if the student is suffering from a concussion or something else?
You're right, Heather. Concussions and brain injuries are on the rise in this age group, so it's very important that they know the signs and symptoms. If a teen or adolescent has been hit, you want to look for a few symptoms. First off, do they have a bad headache? Any nausea or vomiting? Are they having amnesia? Ask them to tell you the details of the most recent play, and if they can't, that may be a sign that they have amnesia and a concussion. Difficulty balancing, being very sleepy, or blacking out. But do not wait until they black out, because that's often a late or rare sign.
And with Adderall, that's the drug that we're talking about here, that perhaps they think that these two players may have taken or been involved with somehow. It has some similar results as these concussions, and that would be bleeding in the brain. How is that?
Well, the issue with Adderall and with all of these is that it can raise blood pressure. And we know that having a dangerously high blood pressure can increase your risk of having a bleed in the brain from whatever reason. So if anyone's taking Adderall at prescribed doses, it's really only going to raise your blood pressure a small amount, a real but very small amount. But if they're taking it and abusing it or taking more than they should, it could dangerously raise their blood pressure and increase their chances of bleeding.
All right, I should say that has not, in fact, been confirmed at all, although one student at the same high school was arrested for distributing the drug. Finally, for parents, what can be done if their student does suffer from some sort of concussion or injury during a game? What's the first thing that they should do?
First thing they need to do is take the student out of the game. If there's any sign of a concussion, take them out until they can be fully evaluated by somebody, and they don't return to any play until their signs and symptoms of a concussion are gone. And they also need to remember that helmets, even the best ones, don't prevent from concussion, and pay attention to practices, because the vast majority of concussions happen in practice.
So stay aware. Dr. Gillespie, thank you for joining us. Great information for parents at home today.